we all want to age successfully in all ways, but there are 4 factors that really make a difference. Jeff, mental activity, physical activity, social engagement, and then controlling vascular risk. Will you start with the first 2, mental and physical activity?
Sure. Yeah, so the big question that we are all after answering is, can we prevent Alzheimer's disease, and can we age successfully and maintain our brains as best as possible? And I think those 4 factors really sum it up well, that we can do something about our brain and our brain health, and I'll just repeat them. So it's mental, so cognitive activity,
reading books, puzzles,
reading books, puzzles, coming to lectures and talks, and staying engaged, staying curious, reading, anything to keep your brain engaged, and crosswords. You hear that. That's sort of the classic example. Who likes crosswords? I've never done a poll like this, but maybe 1/5 or 1/6 of the people here. I don't like crosswords. Don't start them if you don't like them. Start something else. But puzzles and crosswords and things to keep your brain engaged. So that's what we're talking about when we talk about sort of mental or cognitive activity. Learning a new instrument. I could go on, but it should be individualized. It should be something that you're into and that you like and that you can sustain. Then the second's physical. Mm-hmm. So physical activity, exercise, walking, steps per day, just trying to get more activity into your day. And we can do that through a lot of ways, and it's hard to do. But the classic is get out and walk 30 minutes a day, and we think that's probably the best way to do it. Get out and walk for 30 minutes a day. Try to accumulate 150 minutes a week of moderate physical activity, and that's walking. That's walking so that you lose your breath a little bit, just a little bit, maybe break a sweat, and that's enough to have benefits. But I don't think people should get hung up on a goal of like 150 minutes a week, because that's a lot. But the truth is, going from 0 to something is your biggest benefit. You don't need to get to 150 minutes a week to get a benefit for the brain and your body. You just got to get out and do some. And we actually just published, or we're about to publish a research study that we spent the last 5 years doing, which basically tells the story of a little is enough and more is better. So we, in a real fancy, scientific, rigorous way, controlled the dose of physical activity in a group of 100 people, and saw that we do see benefits with a little, and we see more with more, which is the message that we really were testing. Everybody asks us what's the right dose and what's the right kind of exercise, and we're studying that too, very hard. Do we need to lift weights and walk? There's all kinds of questions, but just getting out and getting some exercise in is important. And I could go on. I'm just going to, one last thing is, you might buy a pedometer. Buy one of these wrist-worn pedometers and see how much activity you have in a day, and then try to increase it. Try to get more steps per day. And the way to do that is just to not think about exercise as one point in time during the day, but think about trying to get more steps into your day. Ann talked about some of this earlier. Park away from the store. Pace around during commercials or while you're on the phone. Just try to boost your steps and increase your day-long physical activity, and those things can have a benefit. So that's the first 2, mental and physical.
Would you say physical too maybe is the most important of the 4, because it has such a broad effect over so many other things?
Yeah.
I mean, it helps sleep, it improves mood, helps with the irritability and anxiety, increases your energy. So lowers bone loss is a problem as we get older. It affects us in so many other ways.
Yeah. So yes, you nailed it. I mean, it helps our mood. It helps our mental health. It helps our physical health. It helps our cardiac and cardiovascular system, and we're going to talk about vascular in a minute. Okay. But it and our sleep. And one thing we're trying to figure out is why would physical activity boost the brain? And we don't know why. We have a lot of theories, and we have a lot of evidence of certain things. Lots of things change when we exercise. Hormonal changes, inflammatory changes. We see, changes in the brain. But we're trying to, and blood flow, for instance. We're trying to understand what exactly is it that links physical exercise with brain health, and if we can understand that better, we'll be able to use it better. But exercise changes your whole physiology, and we know it's important for 100 reasons, and we now are developing the evidence to say it's also important for your brain, and it's also potentially important for preventing something like Alzheimer's disease, which I don't know if we're going to get into that a little more. And when I say prevention, I just want to say what we think about is, can we delay the onset of Alzheimer's disease? We don't really know who's destined to get Alzheimer's disease. We know a big percentage of the population is, if you live long enough. But if you're destined to get it at, say, 75 years old, if we can push that back 5 years, if we can delay the onset by 5 years, if we can do that across the population, we'll cut the prevalence of Alzheimer's in half, which is an enormous benefit on a population level. But that's the idea. That's what we're working on through exercise and diet. If we can delay it 5 years, 2 years, 5 years, we'll have a big impact. So that's what we're working to prove, and working to use that and optimize how we use that better.